Okay, still got some people coming in here. Welcome to another Zoom call, everybody. Got a few questions that came in, so we'll get to that. Reminder again, please make sure you go to the member site. That's where you're going to find anything you need. Go to labs, go to the Rupa site to get labs. If you need help, like what lab should I order? Just email me at labs@connorsclinic.com or through an email that we sent you, and I will send you a link to do that. Also, if you can, we really do need, from a legal standpoint, that you complete the coaching call request form. I know sometimes people aren't doing that because we get calls from people and it's nobody on this call. But we get calls from people that started with us a couple years ago, and they're doing great. So they haven't logged into the member site for ever, if ever. So you're just missing out on some information that could be beneficial for you. So we just want to encourage people to do that and remember to do that. Okay, I don't think we need to go over any more information about the TrueRife software updates. If you haven't updated your computer as of right now, probably just wait until we need to, till the 7th is out. But if you are really techie and you want to get your software updated and things, then contact the clinic and we can go over some information on how you can do that. Okay, let's jump into the questions. I recently completed 25 sessions of radiation treatment with 50 grads. I think that's rads, cumulative dosage of colorectal tumor. There are some side effects like painful to pass stool, some prostate, pain also while burning, while urination, not well hydrated. So these are negative effects of radiation on other tissue. Now, the positive of doing radiation therapy is that where it's going to hit in the distinct dosage is going to cause cell death. And that's what we want. We want cell death of the cancer, but where it's going to be diffused, it's going to cause cell damage. And when there's cell damage, then you end up with side effects of that cell damage. So you want to do everything you can to try to heal those cells. And so what do you do? So is it just a matter of trying to use detox protocols to detox the radiation? Well, I think that is necessary and you should do that, but you have to support the cells that were damaged. So that goes cell line by cell line. So in this case, how do you support cells that were damaged in the intestinal tract without supporting growth of cells in the intestinal tract? I would say using products that you would use to help heal the gut that have low amounts of glutamine in it. Things like, okay, so let me just pull something up here for you so it'll help understand this a little bit. So like our Clear GI product. Our Clear GI product is the reason why I like that product is because it has, I'm going to pull it up here so you can see it. So it does have glutamine in it, but it has 1.5 grams of glutamine. This is per tablespoon, and I tell people with cancer that are taking this because they need to heal their gut to only do a teaspoon at a time. So you're only getting 500 milligrams of glutamine, which is an acceptable dose of glutamine. but it has these other things. You can find other products on the market. Matter of fact, you might have some in your cupboard that have some of these other things. Modified citrus pectin, right there, can be helpful to bind radiation, but it can also be helpful to help heal the gut. Deglycerized licorice. So deglycerized licorice can be very healing to the gut. Many products are you can find on the market that just have deglycerized licorice, DGL, it's abbreviated. That is very healing to the gut. Aloe vera extract is very healing to the gut. Slippery elm, marshmallow, chamomile, okra, cat's claw. Well, cat's claw is helpful for any bacteria in the gut. MSM is an anti-inflammatory for the gut. Quercetin, an anti-inflammatory for the gut. So those are the things that you would think about taking for the gut if you don't use this product. You might have another product that has these things in. I just thought of this when this question was asked, so I pulled it up. So also, this person said they're having issues with prostate. So then you think of prostate products that are going to help. So using the Prostate Supreme or our ProstaClear product would be great things to do. You need to support the systems that are damaged. So if you had, radiation to the chest with breast cancer and you're having lung issues, then you think of cordyceps, you think of our clear lung product, things that are going to help detoxify the lungs themselves, help heal the lung tissue themselves. So depending on what organ, what tissue is damaged, that's what you'd go after is from a nutritional perspective to try to heal that. In general, what do you recommend to heal the body? Any non-cancer cells affected with this type of treatment? So I explained that. I understand high dose vitamin C also helps. Some people suggest that raw vegan food may not be good after such treatment. Well, this is what we've talked about before multiple times. You hear about this so often, like every cancer patient should go on a raw food diet. Every cancer patient should start juicing raw vegetables and start just drinking that. That's going to cure you. This is not true. These are just statements that maybe that would be great. A raw food diet might be great if you're 22 years old, but if you're 44 years old, raw food diet are really difficult to digest. If you have the radiation in the colon area and you have a history of colon cancer, therefore the radiation, a raw food diet is going to be even more difficult because you already have compromise to the colon. It's going to be more irritating. And yeah, so I would not suggest a raw diet or juicing or anything like that. Cooked vegetables are the way to go. I've talked about this before. When people have really damaged guts, they go on what's called a GAPS diet, where you're just basically making soup and cooking it all day long. So it's already very pre-digested and easy to break down for your gut. And you're drinking the broth of the soup. So you're vegetable broth and some of the meat broth that can be you make a chicken soup or something. That is the mildest on the gut, and that is really helpful to start healing. So I would suggest radiation to the colon, raw food diet, absolutely not. A very cooked food diet, a GAPS type diet, a soup type diet would be the best thing for a period of time to help that heal. So yeah, I would not suggest that. I think that would be more irritating, harder to heal, cause more problems. I'm looking at the grounding products. Is there a benefit to getting the grounding sheet over the grounding mat? Good question. Why would you use the grounding sheet or the grounding mat? What's the better one to buy? So the grounding sheet is a different material. So here's the grounding sheet. So the grounding sheet is a very lightweight material that's got the fibers in it that will then go back through this wire. Then you attach this wire, that section right there, to the sheet. It's got a snap to it, and then this goes to the wall ground, out to the ground in the ground. This is a very lightweight material that's easy to sleep on, and doesn't it's not gonna irritate your body and cause you any ill health as far as sleep goes. And again, you put this, like we talked about last week, just on the lower half of your bed across your whole bed. It's a pretty big piece of material. So we have people that get this and use this, not just, well, you leave it on their bed because you put it underneath your fitted sheet, so you don't have to take it off. So it stays on there permanently. But people use this and just sit on this as a grounding pad too. So the difference between the two is the grounding pad is made up of a different material. So here's the material for the grounding pad. So it's more of like a foamy type material. So it looks better on a chair. So typically you use a grounding pad for daytime use on a chair and use the grounding sheet on your bed. You could use the grounding pad on your bed too, but that's typically not the purpose of it. But to be honest, I have had people get this and use this on their chair too, and just cover their chair with it, or they can fold it up and sit on it. And so you can use it any way. They both plug into the wall with a thing like this the same way. They both have the same basically operation. The grounding sheet is going to cover a greater amount of your body if you're rolling around in bed and such. So it's just different application, but they do the exact same thing. Are animal foods really that bad during the healing stage of stage for cancer? And if it's grass-fed, free roaming meat. So yeah, there's, again, you look on Instagram or Facebook, or you do a search on it, you're going to see even practitioners that will badmouth animal products big time, and that everybody needs to go on a vegan diet, or like we've talked about. And that is just false information. That's just wrong. Most of the people that are touting this have don't have any substantiation to their claims. A lot of the practitioners that tout this, of course, they happen to be vegans themselves. They've never had cancer, and they've never treated anybody with cancer. Again, I've said over and over for the last 25 years, every person is different. Some people, animal products can feed a cancer at a period of time, especially if their cancer is heavily fed on amino acids at a period of time. But that changes. It can change. Cancer is always trying to find a fuel source. Then what are the bad things about eating animal products? What is the bad thing about eating meat? The answer is nothing's bad about eating meat. So if you didn't have cancer, you should be eating meat. I am not in favor of even a person without cancer being on a vegetarian or vegan type diet. There's a lot of people that are doing it for different belief systems now. I don't think that's a healthy way to go. You need protein with serious disease like cancer in order to develop lymphocytes, in order to create T cells and tumor controlling white blood cells that are going to kill cancer. So you need meat at some point in time. Now, again, everybody's different. What's the best way to get meat? Yes, grass-fed, free roaming, natural, fish that's wild caught. Yes, there's inherent problems with any food source whatsoever. So there isn't anything these days that is perfectly clean. So if you know the farmer that you're getting your food from, it's going to be much better. So, but again, every person's different. Getting tested is really important. Are there specific indications or parameters, that is blood, that allows the discovery of cancer in an early stage? And what are these parameters or indications? And are indications or parameters different for each kind of cancer? Okay, well, that speaks to something I was just talking to my staff about today, because I've been seeing these Instagram posts and these Facebook posts say a really nice little infographic that says one blood test can find, you know, 20 different cancers or 12 different cancers. I don't remember what it said. And it was a very nice looking infographic. And I thought, huh, was there something else out on the market? So I bid on it and clicked on it. And it was talking about tumor marker testing, which told me that that infographic and whoever is putting it out, and I didn't go any deeper to find out who was publishing this or paying for the ad. It was uh, very misleading, to the point of it was just a lie. You can't diagnose cancer with a tumor marker test. So I have a blog post on tumor markers. I'm very big into using tumor markers as a way to help you have another non-invasive indication of tracking your cancer. It can be beneficial. If your cancer is showing positive tumor markers, then you could use that to help track your cancer. You never use one test alone. Nothing stands on itself. Nothing is a perfect gold standard. But to say that you would do a tumor marker test, and if those were negative, if those were all in range, then you don't have cancer. Oh my gosh, that's like malpractice. It truly is, because a person, how many people have stage 4 cancer and all their tumor markers are within range? Because a lot of cancers don't show positive tumor markers at all. And some typically will, like PSA is a tumor marker for prostate cancer. Almost everybody with prostate cancer is going to have elevated PSA, but there's a large percentage of women with breast cancer that are not going to have elevated CA19-9 or CA15-3 or CA125, or so they're not going to have elevated tumor markers, and they could have stage 4 breast cancer. So to say that do you do a blood test and do a tumor marker test and it's negative and that you don't have cancer is foolish. It can be an early indicator. So getting, if like, oh, I'm just curious, I don't feel well, and my mom had cancer and my dad had cancer, so I want to know, run a tumor marker panel. It can give you some indications, but it's just one test. And don't go off of one test and think that you don't have cancer. And likewise, you could have elevated tumor markers and you don't have cancer. So there's other things that can elevate tumor markers. So be careful what you see out there. There's a lot of misinformation. And yet, I feel like we take such a balanced approach, and yet Google and YouTube hate us. I just don't get it, but well. Alternative options to add to aromatase inhibitor. So what are some alternative, and this, I think the next question ties into that too. What can I do to avoid taking the hormone blocker, which is an aromatase inhibitor after surgery of breast cancer? Yeah, I have some blog posts on different aromatase inhibitors. And again, no aromatase, no natural aromatase inhibitor is going to act like the drug. So the drug is going to basically shut down all your estrogen and progesterone. And that's why women hate it, because you have no estrogen and progesterone. And it's really just that one group of estrogens or progesterone that is the culprit in hormone positive cancer. So to shut down all estrogens seems to be like, there's a sniper in New York City, so we'll hit it with an atomic bomb and we'll kill the sniper. Well, I guess you will, but if you just used, SWAT team, could you do the same thing and not kill 30 million people along with the sniper. You know, that's the question that you have to, the decisions that you have to make. Natural aromatase inhibitors are going to decrease bad estrogens, not as quickly, not as beneficially as completely as a drug. And you have to weigh out the pros and cons of that. A lot of people will use the drug for a short period of time and then switch to natural when they've reduced the estrogen enough to really shut down the cancer. Are cancer cure statistics accurate? Well, we don't have any statistics, you know that. From a medical legal standpoint, we can't keep track of statistics. Medical cancer cure statistics, I go over this in detail in my book, but a statistic through the American Medical Association with cancer is based upon the date of diagnosis. So if I was diagnosed in 2020, April of 2020 with cancer, if I live till April 2nd, 2025, no matter how, you know, the quality of my life in those 5 years, if I live one day after the 5-year date of diagnosis goes by, I'm put down as a statistic of cured. So that's how those statistics work. And you could say that those are really rubber numbers. They are. You could say that that's really an unfair way to do things. It is, but it's very difficult to clarify that. I mean, how do you say somebody is cured of cancer? Well, when they don't have, you know, anything, when they have no evidence of disease on a PET scan, when they have no evidence of disease on an MRI or a CT scan, you know, that's one way, but, you know, then a year later, now they have metastasis and they have evidence of disease, because a PET scan and an MRI CT scan, you know, is not going to show cancer unless it's over 3 million cells large. So it doesn't mean they don't have cancer still. That's why I say don't stop using your right, don't stop doing your therapies. But so how do you define that? And the medical industry knows that you can't really define it that way. So we're just going to go based upon whether you live 5 years post-diagnosis. And of course, the problems with that is that you could have lived a horrible life and you die one day afterwards, and they still put you down as cured. Now, the other flip side of that is that if you don't go through their portal, if you don't stay in contact with an oncologist, if you kind of stepped out of that field and you're doing alternative things, how are they keeping track of anybody? So are they just assuming that you live 5 years and they're putting you down as cured? I don't know. I don't know where this is being kept track of. I don't know of any portal that exists. I've never seen it in writing where an oncologist is supposed to keep track of the date of diagnosis and the 5 years later. I don't think that exists. I don't think there's a nationwide you know, medical portal site that is time-based tracking date of diagnosis 5 years later if that person's still alive. Quite honestly, I don't think that exists, which makes me think that a lot of these numbers are kind of made up. And especially if, you know, you don't choose to do standards of care, you're not, how do they even know if you lived or died? What are they doing? They got a nurse looking at obituaries every day? I mean, I don't think so. So how is any of these statistics even, you know, kept up? We have people that contact us, and we haven't heard from them for 10 years, and they contact us, and, you know, out of the blue. And, you know, we have to, like I started off this conversation, and we have to explain to them, hey, now we have a member site. You need to get on this. And this happens every week almost. And that Marina is literally having to get a person on the member site that, you know, they haven't contacted us for years. We didn't even know if they were still around. And that's okay, because we're not trying to create this dependency on us. We want you to be independent, and really we want to be interdependent so that you do have us as a resource when you need us, but we're not trying to create a unhealthy dependence that you have to stay in contact with us. So we want people to be educated and feel like they can go off on their own. Just got an email yesterday from somebody who we haven't heard from since he started 3.5 years ago. So it's that's okay, but how would the medical field know and keep those statistics? I just don't think it actually happens. So no, that was a long answer for are these statistics reliable? No, I don't think so. Okay, questions come in on the chat. When I rinse out my Ion ProWave after each use, sometimes I get a pretty good sized chunks of rusty metal that fall out like a flat 1-inch piece, and it seems to be working, so don't worry about it. If it's working, how you'll know that the Ion ProWave isn't working is that, boy, every time I used to use it, it used to turn really, this color, and now it doesn't. It just seemed like it just all of a sudden changed, and it's like it's not changing, turning that color anymore. Then it's time to replace it. So they last anywhere between 50 and 120 uses, depending on the quality of your water at home, and so you just need to order a new one if you get to that point. So I wouldn't worry about it if it seems to be working. Since the Rife update, 3 or 4 of my daily programs won't run. I get an error message about the duty. Okay, so then I will have to fix that. So wait till the January fix on those then. So yeah, planning then to have the update with Cheeks on that. Yeah, I would just wait till that. Ever heard of Fred Hughes and or Dr. Rob Dowling in regarding dental toxins and cancer? I've read several books on dental toxins, dental root canals and cancer, and they're tied to cancer. Quite honestly, I can't remember the authors. So and these might be more recent. That was a number of years ago that I did that. But definitely I would say that I would agree with probably anybody that's talking about dental toxins and cancer and vaccinations and cancer and things like that, because it's just, there is definitely a tie to those. Best way to get rid of visceral fat. My surgeon says I have a little bit that I need to get rid of. I still eat your diet protocol, fast 16-8, eat stevia, monk fruit instead of sugar, maybe 10 pounds overweight. I would caution you to do anything different. If you're doing all the right things and you carry a little extra visceral fat, do not think that some textbook BMI is perfect for you. Everybody's a little bit different. The least healthy people throughout all my years of practice have been those that have been very thin. And so I am just not a fan of trying to stay to some level of perfection. You do what is right, and if you carry a little extra visceral fat, that's just perfectly fine. I would say don't worry about being 10 pounds overweight. The only person should be weighing themselves, I think, is if you think you're in a state of cachexia and you want to make sure that you're not losing too much weight. Will clothes block grounding for a grounding pad or chair, even a grounding sheet? Yes and no. So it depends on how much clothing you have, and depends on what kind of clothing it is. The more synthetic the clothing, the more it will block the grounding. So it's obviously better to have a skin to grounding pad contact. And I will tell you, we have some people that use the grounding sheet as a over the top. I said, and it's what it's recommended is to put it underneath the fitted sheet. I have some people that put it on top of the fitted sheet, so they're laying on top of it. I have had some people over time put the grounding sheet over them in different areas, using it during the day to protect them if they have to sit at a computer and they feel like they're in an area, they live in the cities or something where they're getting a lot of EMFs. I've had people that would get an EMF meter and just read where their office is really super high in EMFs, and they'll put the grounding sheet over the top of them. So there's all sorts of different ways to use it. The point is, though, really, remember, what is the purpose of grounding? You are picking up positive ions from EMFs, from electrical, dirty electricity in your house, from everything in the world. You're picking up these positively charged ions. The idea of grounding is that you want to disperse them with a balance of negatively charged ions, and you get the best source of negatively charged ions is the earth itself. You go out in the yard. You don't need a grounding pad to sit on all day. If you're walking out in the yard every day and you're going for a short walk and touching the ground and dispersing those. If you have a dog that you let outside and he's running around outside in the yard, and then you come in and you hug the dog, you're basically dispersing all those electrons. If you think of it as an electrical charge and that you're trying to just disperse that electrical charge, that's probably the best way to, get it, into your head that way. It's not a matter of you need to stay grounded 24/7 a day, hours a day, or you're going to, have these horrible negative effects. It's the accumulation of these that isn't dispersed. So if you could think of it that way, that would be better. Thank you, Ed, for that clarification on that. Appreciate that. I have started using an infrared sauna. My whole life, I've been a terrible sweater. So I think what you mean, you don't sweat well. Most people that would say that they're a terrible sweater in this world sweat horribly, or a terrible sweater could be used this time of the year in an ugly Christmas sweater contest. But I know what you mean. You don't sweat a lot. I can sit in the sauna for 20 minutes at 140, 145 and barely sweat. If I walk on a treadmill for 30 minutes before getting in the sauna, then I do sweat better. Do you have any recommendation, encouragement for my body to sweat? Yeah, that is hard. Some people have told me in the past that they just do not sweat. They've never sweat. They don't sweat when they're outside. Those are all bad signs. You need to get your body sweating. So anything you can do that if you find that walking on a treadmill for 30 minutes and then doing the sauna, I have had people say they don't sweat, and they've gotten the sauna, they don't sweat, and the more that they do the sauna, more frequently they do the sauna, the more they sweat. So that you might find that to be true too. So I don't know if you just got a sauna just recently. If that's true, you may find that the more you are doing the sauna, the more you are sweating. Make sure you're fully hydrated too. So some people don't sweat because they just don't drink water and their body is just holding fluid. So make sure you're decent, have a decent hydration too. I listened to Jane McClellan's talk on the recent cancer summit. She said if you go on a ketogenic diet, you also need to do something to block interleukin-6, or you could get cachexia. She said that ivermectin works for this. Have you ever heard of this happening or seen it happen to anyone? I haven't heard anything about ivermectin blocking interleukin-6. So interleukin-6 is a inflammatory cytokine. So it is so what from a nutritional standpoint will decrease interleukin-6 is green tea extract is the most powerful thing to decrease interleukin-6. So interleukin-6 is an inflammatory cytokine. It's what it's common in a lot of chronic inflammation, chronic inflammatory conditions, arthritic conditions. It is very common with bone loss, with osteoporosis. Osteoporosis is technically an inflammatory condition where you have a high amount of interleukin-6 buildup at the osteocyte location. Using green tea extract is really important. And I used to say that green tea extract was the only thing that was proven through studies to decrease interleukin-6. Well, and I say I used to say because at one time that was true. Recent studies show that curcumin does decrease interleukin-6, though not as powerfully, and resveratrol decreases interleukin-6. So again, it's back to the flavonoids that decrease inflammation overall, but it's green tea extract that's the most powerful with interleukin-6. I have not heard about ivermectin working to block interleukin-6, so I would be interested in what she said with that study. I'll have to look at her lecture. What are the most important things to do for EMFs? When I look at some suggestions like Mercola's, it seems like a lot inexpensive. Also, what's the point of turning off your Wi-Fi if your neighbor's Wi-Fi signals are also zooming through your house? If EMFs were a significant problem for our cancer, would you have come up with that when you do our cheek swabs? Yes and no, because EMFs are rarely the cause of a cancer. They are causes of other ill effects in your body. They can be disruptive in all body functions in all cancers, but they're rarely the primary cause. So what can you do about EMFs? Well, that's very difficult because you're right. If you do turn off your Wi-Fi, you still have your neighbor's Wi-Fi that you could pick up if they had their password. However, it's the farther you are away from the source, the less effect it's going to have on your body. So, I've had people that were really highly sensitive to EMFs, and these were more so when I was seeing a lot more Lyme patients. So people that have some chronic Lyme issues and chronic mold issues, many times it's crossed the blood-brain barrier and it's caused an inflammatory process in the brain. If you have inflammation in the brain, whether it's due from Lyme or mold or post-concussive syndrome or brain tumors, if you have any reason to have an inflammation in the brain that may or may have not have caused what's called microglial priming, and you can watch my video on neuroinflammation. I think I have several blog posts on that, on brain inflammation, that will help you understand neuroglial priming. These people with that are much more sensitive to EMFs because your neural tissue is going to be more affected by EMFs than, let's say, a breast tumor. So that's going to be the greater concern for EMF sensitivity issues. Remember, you also have that genetic, that CAG, whatever, NA gene, I think it is, that if you have a lot of defects on that gene, you're going to be more sensitive to EMFs as well. So I would have noted that in your genetic review. But if you have brain inflammation of any kind, special neuroglial priming, you're going to be more sensitive to EMFs. And I've had people in that category before that have used those sheets. So taken this sheet, because these are fairly large when you open them up, and have pinned them up in their bedroom. So pin them up on the wall behind their bed, pin them up on each wall of their bedroom to block EMFs at least while they're sleeping. We had one gal who's developing dementia, early age dementia. This is what I had her do. And I think it slowed the dementia. That's all which you could really hope for dementia. So have this, she has one on her bed. Well, why would you do this? Because it's a grounding sheet. I know, but with the fibers in there, it blocks EMFs too. So yeah, that gets to be costly. That would probably be the less costly fix. There's other things that you could do with whole home, the static, the static products. So, but that gets expensive too. So like here's the whole home EMF thing, but ooh, I didn't turn on. So let's do this again. So you could look them up, the whole home EMF blockage thing, this thing right here. That we have on our website, not have very many people buy that, but this you connect to your wiring. It's like $1,300. It actually saves you electricity because it saves the surge on all your electrical products. So it does pay for itself in a couple of years from your electrical savings. But that's for dirty electricity. So that's not gonna protect you against the neighbor's Wi-Fi and things. So it does, how many things can you do before you go broke in this thing? So there's some things you just can't do. So I suggest just take a more common sense approach. I still think it's beneficial to turn off your Wi-Fi at night while you're sleeping. Why you don't need that. Get your cell phone away from you while you're sleeping. Put it in the other room. Put it in one of our little bags. Those little bags made out of this material cost you very little. The Faraday cages are your best bet for things like that. Like this person, you basically tried to make a semi-Faraday cage out of her bedroom with these sheets. So you just have to have a balance with everything. If you're gonna just go overboard and go crazy about it, then you're getting out of balance. And just do your best without causing financial stress in your household, and emotional stress and anxiety in yourself as also. I am also a poor sweater per consult with developer of Therasage. I sit in mine for 45 minutes at 165. That's interesting. So higher temperature for a longer period of time. Has that helped? I'm interested. Do you sweat a lot more, or is it just the length of time is causing you to, have a greater amount of sweat? Yes, river sweat. Oh, river sweat. Yeah, I think there was a dance troupe by that name once, wasn't it? No, I guess it was different. Okay, any other questions? I would agree. You have to work up to a longer period of time. Like I've said, I don't think I could ever go 45 minutes. I guess if I really worked at it, but I don't have trouble sweating. So when you start to feel yucky, get out. That's the good piece of advice there. All right, I think with that, we will say goodbye. So thanks everybody for being on. And I exhort everybody to be praying for everybody else. So sometimes it's good to get our mind off of ourselves and on to try to help others, and praying for others can be a very, very important thing to do for everybody. So know that I love you. I hope you're not stressing out about Christmas, and it's going to be a good season for everyone. All right. Bye-bye.